We're going to show CancerBot's new patient navigator support. This, of course, can also be used by doctors or patient navigators to invite patients to explore the trials that might be available. So I'm going to enter an email. You can enter your name. It's if you are a patient navigator or doctor, the name is required because we're going to invite the patient based upon what you say. So you do want to provide the name. Okay, so now we're going to go ahead and add the patient. And we're going to say Alice Smith. Just enter an email that's not the email that you signed up with, ideally the patient's email. Okay, so the invite was sent to the patient, and so now the patient needs to respond. And so I'm going to accept the invitation. Let's go ahead and show this here. You can see that this is in my email client. Hi, Alice Smith. Adam Blum has invited you. So we accept the invitation. And then I'll just be asked to set up my password because I already have my email. And so we accept it. Okay, now I'm going to be prompted to set up to onboard for what my disease is. I'm going to go ahead and pick follicular lymphoma. And the stage is stage 1. And I've received 1 line of therapy. And I've received involved site radiotherapy. And the outcome is stable disease. The end of the therapy was October last year. And the country, I'm going to enter United States of America. And this zip code, that's it. So now we have trials. The trials are ordered by goodness by default. So you can see we have a good trial here. You can also order it by match, what percentage match you have. You can see some of them, we've matched quite a lot of the attributes, and we can also just order it by distance, whichever one you choose. Turns out that the highest goodness happens to be the closest distance because distance is part of the goodness rating. So let's go ahead and click on this trial about tazemetostat and belinostat. Here we've got a trial. You can see that it's scored based upon the distance, the risk, the benefit, and the patient burden. If you want to see more, you can change the weights of those and you'll get different ratings. If you want to see more about how we do this, you can click here and we take you to an article that shows you how we do this. We collaborated with Harvard Med School on all of those metrics. Burden is based on the research by Getz on burden. Risk is based upon we have a rubric that's based upon previous results of earlier trials. Benefit is based on a standard called ESMO MCBS. And distance, of course, we have like a log scale on the distance. So it's a pretty good trial. And we also show, normally you would have to read all of this text and say, hey, am I really matched or not? But we break it down by all the attributes here. You can see them all here. So some of them we've already met, and some of them we have not met. So we can actually click on this little AI star thing, and it will then ask questions to get us fully eligible. And so we can go through and answer what's our ALT, liver enzyme level, and it will ask about all the other questions that we're missing. But we don't have to do that to register our interest. We can just click on more information, and then we'll be contacted to work with a navigator to understand better, so the patient can understand better what the risks and benefits and side effects and patient burden would be for that trial. So that's Patient Navigator support in CancerBot.